In ALL, we're witnessing a revolution in a treatment and outcome of patients with ALL. One of them is Ph-positive ALL. Historically, these patients used to have a very poor outcome with survival only of 10% at 5 years. Then we had transplant that improved the outcome to 30-40%. Then we had the tyrosine kinase inhibitors added to chemotherapy with or without transplant. We're at 40-50% survival. Then we get the very potent TKIs such as Ponatinib, and with that we move the bar even higher to 70%. And for the first time, we show that transplant is not needed or will not be needed. But then we decided to walk away from chemotherapy by introducing immune therapy up front with TKI. With that, we were able to offer a chemotherapy regimen like the Blinatumomab we showed at SOHO today, where we have 60 patients treated, and the outcome is really amazing. In the frontline cohort, for example, the rate of CMR, or deep molecular response, or no disease at all, is 85-88%, and the survival at 2 years is 95%. So this is a really practice changing, where you give no chemotherapy, only immune therapy, and you cure this disease. So this is really I'm very fortunate to be here today to share this data, because that's going to change the life of so many people. So in this study, what we did is we give Blina and Ponatinib. We did Ponatinib at 30 milligrams per day, and we reduced to 15 once the CMR was obtained. And we did the Blina for 5 courses, 1 induction and 4 consolidation. And the primary endpoint was a complete molecular response overall. And after 1 cycle, the CMR rate was 64%. After 2 cycles was 88%. Furthermore, we did PCR weekly at the beginning to see the slope dynamic of the response. And interestingly, a lot of these patients are responding within 2 weeks. This will open the door for the long-term future, is to see whether we can eventually one day stop the treatment. We're still not there yet, but this is really promising to see early responses, deep responses obtained within 4 weeks of treatment.